Mm.
'Maria, look at the chat.
I'm reading it now.
Two more minutes and we'll start. One minute. All right, so we can officially start the meeting today. We will have to start with roll call, right? And go ahead.
Okay, so I will be calling your name. Once you hear your name, please unmute yourself, say here or present, and mute yourself once again. Thank you. Julio Peña III, Jonathan Martinez,
Present.
thank you. Rosie Mota, Grisela Amador,
Present.
thank you. Damian Andrade, Jalia Bailey, Joan Body,
Yeah.
thank you. Esteban Chavez,
Here.
thank you. Maria Cruz,
Here.
thank you. Jamie Freed,
Here.
thank you. Nicole Huang, Cynthia Jeffers,
Here.
thank you. Joanna Romero,
Here.
thank you. Pat Ruiz, thank you. I acknowledge you. I can't hear you, but I acknowledge. I hear
Here.
you. Okay, thank you. Kalina Surma,
Present.
thank you. And Michael Tom. Okay, roll call has been called and there is a quorum.
Well, thank you everyone for being here today. And it's looking like the virtual format is way more attended than the in-person. So just wanted to highlight that. And with that, we can start with the agenda. I just want to talk about a little more on the priorities for the remaining of the year, as this is our first meeting of the year. I'm going to walk through the agenda, through the immediate priority, then the near future, and areas of focus that we will be eventually touching throughout the year. For the immediate goals, we're still working on the district resource list. We are halfway through the list, and I just want to thank Pat for all the work that she has done on this area and continue to do. And once that is done, we will make sure that all the committee members are, we send a copy to every committee member and also to also send it to the district staff for distribution. Also, we will be working on the QR code, and this is for the newsletter. A lot of people are requesting like to join the newsletter list, but we don't have like a specific way of doing this other than sending the email and subscribing them ourselves. So I will be working with the district staff to better understand the system and to better serve the community as well in that sense. And we also will be looking at newsletter structure. I know there's a lot of information and I want to include more information on it, but we have to restructure the way we share this. And this is something that I will be also suggesting some changes to the district staff and working with the committee members. If anyone has any suggestions or ideas, feel free to reach out to me and we can handle these suggestions to our district staff. In terms of throughout the year, this year, so last year we explored the idea of a health fair, and I feel like we are ready to do a health fair this year. So we will start planning and looking for potential partners for this year. Anyone that is interested in working on this, I know Pat it is, but if anyone else is interested, please feel free to reach out to me. We will be engaging on these efforts very soon. Also, we will be back to the political involvement and engagement. The legislation, the state and local level are back. So that means that we can advocate for certain bills that make sense to our district and to our community. So we will be exploring that, and we will be building an agenda based on that. Again, if anyone is interested in this area, also feel free to reach out to me. Areas that we also get involved is in the budget process, the New York City level, and this is because a lot of the funding comes to our board. So we have to better understand this process and engage to serve the needs of the community board as well. And we will be engaging with elected officials more often than what we have done so far. So I know there's some members that are interested in this area, so feel free to email me and we can chat more about this. And also we started this last year, but I didn't like formally launch the initiative. And this is something that I named Getting to Know Your Community. And part of this idea is to invite CBOs in the community jurisdictions such as social services, education, and health to get to know them better and to see what services and programs they are providing to the community, and for us to have a better awareness of what's going on in our district. And this is part also of the list that we okay. You guys listen, hear me, right? Okay. Yeah. Because I saw a message, but it's not for me. Okay. So this initiative, as I was stating, is part of the like to getting to know more our community and the services that we have available to our community at large, and to make sure that people are aware of them. So and one of these is, for example, Dr. Schindler, which is a CBO and a health provider in the community, in the district. So that would be classified as part of this initiative. But also we are welcoming any other presenter outside of the district that might be beneficial to know for us and for the district at large. And in terms of future and areas of focus, we are engaging more in the education part of the committee. I know we haven't touched more, like really often, we don't touch the education part of it, but given a lot of all the changes that are coming our way, the education will be a bigger focus this year, and also including social services. So social services and education will be a big focus. Um, in terms of social services, a lot of changes as a result of the Big Beautiful Bill, or HR 1, specifically in Medicaid and SNAP. We will be partnering with elected officials and any CBOs that is interested in informing the community about the upcoming changes. This is because more than 70% of our community, at least in Sunset Park, are insured by Medicaid. So all of these changes will definitely be affecting our community. And also we will be having more focus in the work of the community in the district. So anything that comes our way, of course, we are reacting to it, and that will continue the same in that sense. So that's pretty much the agenda for this year. And I would like to hear more about what you guys think about this, and what areas are missing, and what other opportunities are missing in this year. So please feel free to mute and to tell me more about what you guys think about this, or any suggestions. And we can start with Jerry.
Hey, good evening. So this health fair, I love it. What location are you planning to have this at?
So Pat has a suggestion to use the space that we have in the community board. We can make it work in the area. Of course, will be like small to start first year, but eventually we will have to look into other spaces. But that's the idea.
So I do sit on the board of the Leukemia Lymphoma Society. Cancer. It's not. It's actually blood cancer now. They changed the name. So I happy to help get resource to come and speak, right? And then we are also connected to a lot of hospital too. We could also get them to come in and speak about blood cancers, right? But I asked location because I mean we could have in CB7. It depends on the weather, you know, and depends on yeah, it depends on the weathers. Just let me know when you want this, and I'll put it on their calendars and have them start doing something. You want something small, we could start with that. There's a lot of people in the neighborhood don't know about the blood cancer, and they don't know that the blood cancer actually give you $500 to go to check you see you got blood cancer.
I didn't know that. That's actually really interesting information, and I'm happy to chat more with you. I'm gonna put together another call where with you and others interested in this, and we can explore more about what to do and who to include in this health fair. But thank you so much
Great,
for
thank
the
you.
information. And we can move to Pat.
Hi. I know that you said health fair, and I know I've brought this to your attention. There are too many health fairs. And I think the goal, my opinion, of the community board is to introduce themselves and all of the community organizations that we serve to the community. So instead of having just a health fair, a community-based organization resource fair, inviting Dr. Schindler, inviting NYU and all of their services, inviting opportunities for a better tomorrow. This way we can learn more about them because it's been a while since some of these organizations have come to us. And inviting them to a resource fair, I think is a much better idea and pull. And especially if you want this to be not just for the CB to get to know all of their CBOs, but also for the community at large who don't know what's available out there. And that's my opinion. But there are just too many health fairs and so many blood pressures that you can take. I think it needs to be a little bit different. That's my opinion.
No, I share your opinion. I think we had this conversation before, and having health vendors or like health systems in combination with others CBOs, I think makes sense. And we definitely this is part of the process, like getting the idea outside and getting feedback, and that's why I'm bringing this to the community. And thank you for that feedback.
And just to add, just remember, and no disrespect to anyone, words are very important. Community health fair and community resource fair, two very different things. And if someone disagrees with me, please let me know and correct me.
Totally agree with you on that, and I'll definitely will include you and Jerry part of the conversation, a bigger conversation that we have to have. Any other participant have any questions on the health or resource fair or any other items that I touch?
Yes, hi, this is Sammy. Just really quick. I am in agreement with Pat with regard to resource fair versus health fair. One of the other things with regard to health fairs that if we're going to have like blood pressures done, right, then we have to ask ourselves, what is our responsibility when we take a blood pressure and it's like super high? I think we should consider things like that. And that's why I believe that we should go by way of a resource rather than health fair. So I just wanted to share that. Thank you for your time.
Thanks for the feedback. I think I totally agree with you on that one. Yeah, I'm with you on with Pat and yourself. Thank you. And anyone else has any other questions about this or any other item that I just mentioned? And by the way, I will be sending this to the committee via email, so you guys have it with you. And if you have any questions after that, then also feel free to reach out to me. But if anyone has any other questions right now, before we jump to the next section.
Hi. I think we also should think about exactly, and I guess this can be a separate conversation too, what exactly we want the CBOs to do. Like, are they just tabling? Where then it's like the responsibility of the attendees to sort of like go up and start that conversation, or do we want them to give some sort of like 5 or 10 minute presentation, or do both?
Really
I
good
can
feedback.
I can add to that in as a response, in my head, we're inviting them to table not just for the community, but for us. Um, for talk about what they have, and of course do giveaways. That's the only way we will all learn in our community, learn what we have. So yes, it's tabling, and yes, it's giveaways, and yes, it's questions and answers. So we're inviting the public to this, so that's just something to keep in.
Thank you, Joanna and Pat. Like I said before, we will have a bigger conversation about this, and if anyone is interested, like now or later on, just feel free to reach out to me. I'll be sending this to the chat and to the email chat, and we can go based on that. But any other feedback or comments?
Jonathan, can you elaborate more on what you had mentioned in terms of, I think, legislation or helping to come up with policies? Can you elaborate on that?
Yes, sure. So what we have done in the past is that we have identified bills such as the aid in dying, which was signed by the governor. And these are something that was important for some community members that they brought it up to my attention. So we will pretty much follow the same concept. Any legislation that is brought to us by the community, we will look into it and see if it makes sense for us to advocate for. That's the political landscape. In terms of the budget, I know that our community board submits an assessment for the district and also advocates for specific budget items. So this is something that our committee will be involved, and we are asking to be part of this process as well. I know last year it was only a few people that were involved in it, but I want to make sure that everyone else, including this committee, is involved in this process as well, as we have different priorities.
Thank you.
No problem. Pat?
You do know that this falls under the finance committee, so if that's something you want to do, I suggest you do a joint meeting, or let's not step on toes on work that's already being done.
Yes, I'm aware that it's been done, but we're included on the conversations, and I don't think any other committee member was included except for the financial part of it. But
But again,
I
no, what
feel
I'm saying, what I'm suggesting is that you do a joint meeting, ask them to invite the education, whatever we are called right now, to a meeting to be part of that process.
yes, and that's exactly why I put it in the agenda, because I want to explore more of that, and thank you for the suggestion, and I'll definitely reach out to them and to have a better large conversation on this. But that's part of it. That's one segment that we will be focusing on, but there's other areas in terms of budget, like capital funding that we like the community can apply for, or other projects, like civic engagement for the budget that is dedicated specifically for community, like those things that I'm talking about pretty much. So it's like multiple things, but at the same time, it's just like one thing, one big item, which is the budget. But yeah, I get your feedback. Yeah. Thank you. Any other person? Any other member? All right. So, if you have any other questions, like I said before, and I repeat again, feel free to reach out to me. I'll make sure to leave my email here in the chat as well. With that, we'll be moving with Dr. Erwin Schindler, which is is the Chief Clinical Officer of Tulip Behavioral Health, a community-based outpatient mental health center located in Sunset Park. Dr. Schindler brings a decade of experience serving diverse multilingual communities across New York City. Under his leadership, Tulip provides evidence-based, culturally responsive outpatient services delivered by a team of licensed clinicians in a warm and compassionate environment. With that presentation, I'll give it to Dr. Schindler and his presentation. The floor is yours.
Hi, thank you very much, Jonathan, and I hope everyone could hear me. I am really honored that you gave us the time for us to present. We are brand new in the community. I had the honor of attending the last 3 community-wide sessions, so some of your names and faces are familiar, and perhaps my name or face is familiar, and I hope it'll become even more. I was there for the November meeting, I was there for the December meeting, and I was there a week ago or whatever it was for the January meeting. I know that Jeremy is leaving in a couple of days, and I had met Jeremy a few months back, just telling him about what we're going to open. So I thank everybody for taking us in, and I want to tell you a little bit about Tulip Behavioral Health, which is what officially just opened now in January. Really, January 2nd was our opening day. So we're just really starting. And I have some of my staff members here that will just come on quickly to say hello, to give you an idea of some of the staff. But I want to tell you a little bit about it. And I know Rochelle, who's our executive assistant, she was back and forth with Jonathan or whoever it was. And thank you again for working with us as we learn to navigate a new community. For me, Tulip Behavioral Health is my 7th clinic that I am in the process of trying to get off the ground. I specifically look into what I call underserved areas where the need for behavioral health, the old word we used to use was mental health, the need for psychological, psychiatric, emotional support, emotional wellness services. And I try to look into communities where they're underserved, meaning the needs are great and perhaps they have 1 or 2 providers. I don't mean private providers, I'm talking about organizational providers. So I actually went to the OMH Office of Mental Health about 2 years ago, and I asked them, I want to do some good work for communities that are underserved. And they told me about a great community, which is your community. And they said there are great people there. It's very diverse, and to develop something special. So what I want to present tonight, without any fanfare, and I know due to the inclement weather, we have to do this by Zoom. I certainly have pamphlets and things to give out when we'll meet again in person. But I just want a few minutes to be able to give you a feel of what we're doing and what I consider a revolution. That's a strong word today, but a revolution in behavioral health. To start with, we are going to do everything similar to other organizations. And I know there are other people who do things. It's not what we do, it's how we do it. And I want to really stress and talk about that. Number 1, we're open since January 2nd. Today is the 27th. In these 3 weeks, we already have a waiting list of people calling. Number 1, there is no such thing in our offices as a waiting list. People are serviced. We're open for the most part 9 to 9, but we're going to extend that. I don't mean later than 9, but right now we're seeing people pretty much till about 6, but we're going to extend it to 9 with security, lights. We have a 40-car parking lot. There's no problem, especially in the snow days. Nobody could park anywhere. There's going to be ample parking, lighting, security, and so on. But let me tell you what happens at Tulip Behavioral Health, or as we like to call it, TBH. It's an experience. And I'm saying that with a full invitation to everyone on this call, everyone in the community board, and everyone in the community. Just call me, call up. You will get a call back the same day. I want to invite you. You don't have to come. You don't have to use our services. I want to become part of the community. The other 6 clinics that I started, and this is not a business for me. I'm just, a paid employee. This is not my company's, but the other 6 are just flourishing. We could say, unfortunately, or we could say great, because the community is getting service. They're in different areas of Brooklyn. This center is going to become community-based. I don't claim to know everything about every community, but for the last 2 years, I've been working. I go in the streets, I speak to people. I want to hear about the needs, the cultural needs, multilingual needs, and so on. Whatever is going on in the community, I want to be a part of it. I go to these community meetings. I learn so much. I want to speak now to Pat for a second. I don't really know you other than watching you up on the front by the community meetings. My first meeting 2 months ago in November, I'm sure you'll remember, there was a young woman and then her father who spoke about, unfortunately, her mother's death. She was run over by a car when she was babysitting. And it just broke everyone's heart. And here is my first meeting, and I just come to get a sense. I'm a stranger just walking in, and it was so poignant and so moving that everybody was quiet. Number one, I was amazed at how many people come to these meetings. It just shows the community concern. And then Pat, I believe, with other people, after she spoke, you said we have to take a few minutes to, get ourselves together. People were crying. And I said, this is a community that I want to join. This is a community that cares. This is a community that is with one another. And when there's tragedy like that, and that young woman was very brave to get up, and her father, if you remember, he spoke, the elderly gentleman. And then they came over to me later because I was just speaking to them, and they're not coming to us. It was just an idea of showing that we care and we're there. And Pat, again, kudos to you and to the staff that was there. I don't know if you remember, but I mean, I saw actual tears, and you can't make up those tears. So I said at that moment, and I didn't tell it to you, Pat, because I didn't know who you were. I just said, I want to join someplace that really cares about people. I think I said it then when I spoke for my 5 minutes, and if not, I'll say it now. I have young therapists who come to me every day. And yes, we do evidence-based practices. My therapists are a group of social workers, psychologists, psychiatrists, so we do prescribe medication, mental health counselors, and so on. And they love to impress me. And they're going to come and say, Doc, I have IFS and I have EMDR. These are formed modalities of treatment. And I have, give me another one, DBT and CBT. And when they tell me all those things, I always ask them, I said, tell me, do you have HEART? Just like that. And, here and there, somebody doesn't know what I'm talking about. They say, oh, I don't know who offers that. I don't know. I didn't take that course. I said, no, there's no course. HEART is what you start with. If you have the heart, if you care about people, everyone, and I tell people at the end of every session, we'll change seats because what do you think? I don't have issues. Finish telling me about your issues and I'll turn around, I'll tell you my issues. We all are special needs people. We all have issues. And if we don't have issues, God forbid something can happen and so on. Do you have the feel? Once you have the feel for that person sitting across the desk from you, older, younger, whatever race, whatever religion, whatever language, whatever orientation they are, I don't care. Do you have the feel for what he or she is going through? And once you have that, then you could impress me that you have IFS training and EMDR and so on and so forth. But if you don't have heart, I'm not interested in you coming. Behavioral health is different than medical. Medical, the doctor could be tough and he or she could not be caring and be rushing, but you need your flu shot. He or she will give it to you, puts it into your arm, and you're good to go for the winter. That's not in behavioral health. Behavioral health is all about feelings. No one in history has ever seen anger. You see a person acting angry. You don't see anger. You don't see upset. You don't see hurt. You don't see fear. Again, I'm not going to get political here. We know what's going on in the country, ICE, immigration. I know there's a community that's been affected. I heard at the last meeting. The point is, does anyone know what that feels like? We're not here taking sides and right, wrong, or indifferent. And we all know that 99% of the people are innocent, honest, hardworking people. There could be 1% and so on. But 99% of people are innocent, and 100% of the people are in fear, are nervous, are not feeling secure. Does anyone understand that, what that feels like? And everything ends up in terms of feelings. So I'm not here to take sides, and I'm not here to go on. This is not a political speech, but I am here to say that 100% of the people are affected in one way or another. Watching violence. I mean, we saw what happened a few days ago. We're not here to judge, but I mean, the man was killed, and everybody's watched that video 14,000 times. You have to just feel bad. You see a man standing alive, and then a minute later he's dead, and so on. So I'm not going political. I am only talking about the feelings that come about after, the trauma, the things that people go through, challenges money-wise, challenges job-wise, relationship-wise, parenting. Babies are not born. You buy a cell phone, you're going to have 400 pages of directions. And if not, you go on a Google search, how do you program your phone? And I never saw a baby born with a little tag on the bottom saying, here's how you raise me. Okay. So babies are not born like that. The hardest challenge you're going to have in life is how to raise your children, and who's guiding. And that's assuming everything's perfect. And then there are challenges, and there are all kinds of risk factors and so on. So when I open a clinic, I don't just want this as a clinic, just pile in and people. Number one, as I said before, everyone gets a call back. Number one is respect for people. Being responsive is already something that people don't think about. I know people get overwhelmed, but this is my 7th clinic we're opening. People get a call back. Even if the answer is, I don't yet have the therapist you need, or I don't have that Tuesday slot that you want, and so on. There's a respect to just responding to people. People don't realize what that means to other people. It means that I am worth something. And part of that is self-esteem building. When people walk into any one of my clinics, and I really am putting out a personal invitation to everyone. I'll make group meetings, but I would love to give a tour. I've already given a tour to some elected officials. I want to send this out to everyone. You will walk in. We have soft music in the hallways, not in the rooms where the people are. There's coffee, hot tea, hot cocoa, pastries. It just looks nice. Flowers. I don't want people saying, "Oh my God, I have such problems. I am really, from the difficult people, and I walk into somewhere that feels like a hospital and looks very drab and so on." I don't mean to back hospitals, but the point is, they walk in from that first minute. I call it an emotional spa. It's a spa. It's getting your feelings out. Obviously, everything's done behind closed doors, but walking in and right away greeting people. The people in my offices always know the first thing is a smile, and can I get you a coffee or a tea or a cold drink in the summer? That's what it starts with. That's that feeling of behavioral health that's different. And I really push this. I'm going to introduce soon just some of my staff. I have 3 or 4 staff members that joined us. You will see in 1 minute, we work very hard on the HEART, and then we go to the skills. All my people are licensed or being supervised by licensed people. And everybody has access to myself as the overall director. There's somebody, Shoshana Kowalski. She is the acting director there. She's an LCSW. I'm a PsyD psychologist. I have everyone there and it's also a multilingual staff. We are adding staff as we speak. I am very much looking for people in the community, because I always would love it to be people who know the community. We have Spanish-speaking people, on staff. We have a Chinese, different dialect, people who speak the different languages. We are adding more people. I have somebody who speaks various of the Arab languages. I am looking at certainly English, but I don't care who comes in. It's a person who walks in with some needs. We are very much into children, parenting. We are going to be doing groups. We are going to be doing certainly individual therapy, but what's really going to be unique is that feeling of part of a family. You walk in, you join us. It's going to be different, and And I really want to put that out. Until you experience what Tulip is all about, I'm just saying it. But the OMH came to tour at the end of the summer in August. They came to tour one of my other facilities, and the person turned to me and she said, she's head of licensing, and she says, Dr. Schindler, this is an example of what we want clinics to be throughout the state of New York. And they told me straight, are you bringing that to Tulip? I said, God willing, yes. And when I sat in on these meetings the last few times, I said, this is a community that, say what you want, we're speaking the same language. We want to help the people here, people coming with all kinds of issues. And I tell my staff, a smile is a universal language. I don't care what language you speak. People that feel cared about and feel thought about and get an answer, and we do respond. That is what it is. My staff knows that. I will definitely take questions at the end. I just wanted a chance for 1 minute. Do I have a chance just for some of my staff to say hello, just to get a sense of who I have? Is that okay?
Sure, go ahead.
Okay, so let's go first. Rochelle, do you want to just say hello? She should be on. Rochelle?
Sorry, my connection is not so
I
good.
can't hear you. Oh, there you go.
It's so nice to be here. Nice to meet everyone, and we're really excited to help the community. I'm actually a peer specialist, and I take pride in advocating for everyone's needs and making every client feel like they are a priority, and whatever they need, we will do our best to help them.
Okay, let me just tell, a peer means in addition to the therapy, Rochelle doesn't want to brag, but she is a peer specialist and she's trained in that. So she does a lot of that hand holding with families. So it's not just show up for a session, goodbye. She does all the extra work to the point where I have to stop her sometimes because this morning, noon, and night, there's no stop. Would you say that, Rochelle, or you don't want to brag about yourself?
I'll just give the universal smile.
Okay, the universal smile works. Okay, let's go from there. Karina, do you want to say hello? Karina Lopez?
Hi, I'm Karina Lopez. I am the administrative assistant in Tulip Behavioral Health. I am also someone who has lived my entire life in Sunset Park. So I believe that I bring a bit of knowledge of the area, especially within the Latino community, which is a big community in Sunset Park. And working at Tulip Health, honestly, I can say that we are here for the community, and our outreach is to care for the people and bridge the gap that I know mental health is stigmatized a lot in Sunset Park.
Karina, again, I'm putting you on the spot. First of all, Karina and Rochelle, they both have the smile that we need. But Karina, what is it like? We just opened. Do you feel that vibe, or am I exaggerating it? Tell them what it's like at Tulip.
It is a very welcoming space. I can say in my time at Tulip, everyone works hard to make everyone feel welcome. And especially I've done outreach in the community as well. And I can say that Tulip is exactly what the community needs. Speaking with doctor's offices, behavioral health is a big gap in Sunset Park. And a lot of the major institutes in Sunset Park are not accepting of new patients. So I feel like Tulip, with our quick turnaround times, and helping people come in and be seen in the same week, it is very good and it's very reassuring for the community.
Okay, thank you, Karina. Let me see, where's Daniel? Daniel Chen, are you here? Daniel?
Yes, how's it going? Good evening,
Okay.
everyone.
So tell them a little bit about, we're all new there, so tell
Yeah.
them about some of your ideas in terms of groups and workshops and what it's like working so far with us.
Sure, yeah. First of all, my name is Daniel. I'm also a Sunset Park born and raised native, Lutheran born. And then now my son is born in Langone, same hospital, just different names. So, Sunset Park's my backyard, and my parents are right across the street from Tulip. So that was one of the main reasons why I decided to join. Um, But also, I am a mental health counselor, limited permit. So I'm a therapist, and I am super excited to bring these services to my community. I mean, I decided to do the master's program and go into mental health because I want to serve my community, and just kind of break the stigma around mental health. and really educate as well as inform and just bring awareness. Because I think even the conversations that are being had are increasing, but we want to be there for these conversations and build a community around it. That's why I thoroughly enjoy facilitating groups using the medium of group therapy. Um, it's a great way to like introduce people to what therapy could be without having the social anxiety of a one-on-one with a stranger and being vulnerable with someone you've never met before versus being a part of a group, slowly get to know each other. You don't feel so isolated. You're sharing experiences. That's how you build connections, right? And that's how you strengthen bonds. And that's what a community is, right? We're just all bonded to each other because we're neighbors and we share similar interests, similar experiences, and that's what we want to facilitate. In terms of workshops, we want to facilitate an educational aspect at Tulip for people to continue to learn and be exposed to mental health if they haven't been before. So just some ideas that we're thinking about implementing and hopefully we'll execute soon.
Fantastic. And so that's just again a few of my staff. I don't have.
You say good job, Papa.
I'm sorry.
My son is in the
Oh,
background. Yeah.
in the background. Okay, we love children. So, by the way, speaking about children, I coined a phrase, CTW, Children's Therapeutic Wonderland. We are doing something special, and to be honest, we opened up our first 10 rooms, which is what we're doing now, and we are in the process, depending on the need, to do an entire 20,000 square foot addition on top of what we're doing, because we plan to reach out. And I would love your committee, other committees, people from the community just calling in and saying, Doc, could you do this? Could you do that? We can't do everything. I'm going to tell you up front, but we really try to do as much as possible. And the only way we could learn about the needs of the community, besides what we're assuming are the needs, is if you guys reach out to us. We are looking to hire from within the community for those people who are licensed or people, reception jobs, clerical jobs. We are looking, but really when you walk in, it's really feel the warmth, and that's the extra piece. Everyone is going to have licensed people doing the work and so on, but not everyone is going to make the people feel so special, and don't belittle that piece. Self-esteem building is part and parcel. I'm in the field 45 years, and I've learned that that's really important for people to feel good. And like I said, please, you don't have to tell me now. Call me, send me an email. You could go on Tulip BH, TULIPBH for behavioralhealth.com, tulipbh.com. You could call us. We could give you our brochures and ask for me. And not as a client, come, you want to see it. It'll be my biggest enjoyment. And if a few of you want to come from the committee, I think seeing will be believing. Until then, you just think, wow, it sounds great. I will stop at nothing to do what's right for the community. And as I said, this is my 7th clinic. The other 6 are up and running, seeing thousands and thousands of clients, over the year. And this is something that I want to bring to Sunset Park. And I'm sure there are issues there, and I want to be part of the solution, not only part of the problem. So if you guys bring it to us, we want to run groups for the community, obviously free of charge, but groups where they could come and join us, psychoeducation. And really, I guess just to end, our biggest goal is to destigmatize the stigma of mental health or behavioral health in all communities. That is a big one. I want to normalize it. It's okay. We all have issues and so on. So I guess that's really it. I don't know if it was a formal presentation, but I think you got the message. That's the way I present, just as part of the family. And guys, I see a lot of familiar faces. Really, I'll see you in person the next time. I don't know who's replacing Jeremy, but It's a big job to do, but you guys are great. I am so impressed to see so many caring people come to these community meetings. And I'm there November, December, January, some of the worst weather before the holidays, and people show. And I'm honored to be part of this community now, at least, my work time and what I want to do for the community. So thank you, Jonathan. Thank you, the co-chair, the vice chair, and thank you everybody for listening. And I'll open it up for any questions.
Yeah, so we will start with the questions. Thank you so much for that presentation. I know that Grisel have her hands up first, so I will start with Grisel and then we can go based on that. Next is Jerry.
Thank you, Jonathan. I just want to say welcome to the doctor, to the clinic. I live here between 8th and 9th Avenue, and I passed already by that clinic. So I will accept the invitation that he offered, that if we go there, he's going to show us what is the clinic inside. Will be perfect. Maybe one day they can go to United Senior Center of Sunset Park to provide additional information, how seniors can be benefits in his clinic. I know that he has the sign outside, the age, what they provide, because I pass and I see it. So I just want to welcome him to the Sunset Park community, and also United Senior Center of Sunset Park want to welcome his clinic in order to benefit seniors in the Sunset Park community, additional to the others on organizations that also provide excellent work for our seniors. Thank you. Welcome. Thank you. Thank you. Thank you. Thank you.
Fantastic. You're invited. 10 minutes from now, I'll be there. You ready? Tell me
No,
what
I get home already. Thank
you got
you.
home already. I'm a senior already, so I for sure have to care about seniors. You're young, but I'm old. So I'm getting older. I want to answer God one day that I did good for people. So that's all. Please, you're invited. Just send me an email tomorrow or a phone call, and I will reach back out to you, and we'll give you either a personal tour or you could come with others and just tell me what you like to eat, because we make a beautiful meal. Daniel, Karina, is that correct? Do we make a nice spread?
Absolutely, yes.
I
Absolutely.
am sure, yes, and more if they live and here in Sunset Park community, so they know what we love.
Thank
Thank
you
you.
so much. Let us know, and I look forward to meeting you in person.
Welcome, sir. Welcome, all of you.
Thank you, Grisel.
Thank you.
Then we move with Jerry. Jerry has a few questions. Go ahead.
Yep, thank you. So, good presentation. Sound like that. Jonathan, we found our first sponsor for our health fair, right? First sponsor, right? My question is, right, and I put in the chat. Go ahead.
I accept.
Okay, good. Make it big. I'll give you a bigger location.
Okay.
So my question is, right, our community.
I sat right behind you at the last meeting.
I know. I almost punched you when I stretched my right arm the other day.
I forgive you.
Yeah. So my question is, right, our community is made up of a lot of immigrants, undocumented immigrants, and I asked the question, what if they don't have insurance, right? We do have a lot of folks in the community have a lot of mental health issues, right? So I asked the question, if they don't have insurance, they don't have anything, right? What are the charge? Are you guys providing pro bono service, just like how you're providing our first sponsor event? By the way, this is recorded, okay?
Okay, right. It's recorded, so I can't deny it later. Okay, That's a good question. Obviously, other than one company right now, which we're working on, every other Medicaid managed company we will be accepting, plus commercial companies. That's not a problem. We are what's called an Article 31 Motors Clinic, New York State licensed clinic. So anybody with insurances, for the most part, except for one, perhaps two, and we will accept. What happens when someone walks in completely with no insurance? So we have a sliding scale. Can it go down to pro bono? In occasional cases, but I don't want to go online to say everybody's pro bono, because then we'll be closed down within a week. So we will work on the different cases. We do have, even now, we have walk-ins. Today we had walk-ins. People walk in and they say, you know what, could you help me? So that's a sort of not a no, but not a strong yes in terms of complete pro bono, but certainly sliding scale where it's much less affordable than private practice or whatever. But we will not turn someone away. We have a responsibility to help everyone.
Good. That's why I want to hear it. Thank you.
Try me out on that. Listen, I don't mean you, but send me someone. We will not let someone out without, if we can't do it, guiding them and staying with them and what we call hand holding. We will be involved with whomever.
Trust me, I mentioned that I sit in several board. My board will never turn any homeless people down, never people in need, never people who had health issues. Never.
I'm with you on that.
Okay. Okay. Thank you, Jonathan.
Thank you, Jerry. Next would be Jamie. Go ahead, Jamie.
Hey, Dr. Chandler. Thanks for your presentation.
Hey, Jamie, we met by my November meeting. I didn't see you since.
Yes, we did. I've been there. I guess we didn't run into each other.
Sorry.
I was wondering why you chose to register it as a for-profit LLC as opposed to a not-for-profit.
That's a good question. I am not the owner of it. I didn't do that. And there are downsides to it, but they felt, I think, that there is just less bureaucracy when it's a for-profit and we could help the community better. That's what they felt. We're not going to be open to grants as much, but it allows us to do some things that not-for-profits are more stuck with in terms of I don't know, some of the paperwork and stuff. But it's a good question. I've asked it many times. So, but I'm not the owner, so this is what.
Well, you on the OMH website, it did seem like you had 10% ownership.
They just put it there. Okay, this is whatever. We'll talk in person. I don't have any ownership. That's what it's written down. I have zero ownership in it.
Because the for-profit status does perhaps call into question your motives.
Correct. That's what it sounds like. But come and visit us.
All right. Well, thank you.
Well, thank you, Jamie. We'll move to Samuel and followed by Joanna.
Hi, doctor. Thank you to you. I'll wait till you come back to the screen.
This changes everything. But with lights and lights.
Sorry, just the light turned off. Yeah.
That's okay. Thank you. Thank you to you and your team for the presentation and sharing your time with us. My question is pertaining to process. Hypothetically speaking, patient presents, right? Upon visit, it is deemed that this patient should not go home alone because they're going to harm themselves. I'm concerned, or rather curious, about what that process is, number one. And number two, are those patients referred to local institutions, or is there somewhere else that they would be sent to or referred to? And thank you again.
Okay, so that's a great question. And any Article 31 Motors clinic has to have a full high-risk policy, which is something that we worked on. Our director, she's not on now, Shoshana Kowalski, Ms. Kowalski, she worked for 10 years running Kings County outpatient unit. And she's very familiar with people that, whether it's self-harm or some other. You there? You good?
Yeah, I'm looking for my power cord. Please continue. I'm sorry.
So she worked with these high-risk cases. This is what she did for 10 years in running that program. But we have a whole system of what we do. We will triage it. We will evaluate. And then there's a process to go through. If we feel that person is really dangerous and cannot go home alone, so certainly, I mean, in the extreme case, we have to call 911. That we have to do. If not, we can call a next of kin, a spouse, a relative, somebody who can, tell us that person will be okay. Sometimes we send the person directly to the hospital if they're with somebody who could guarantee that they're going to be taken care of. We follow up with phone calls, but no, we will not let someone out who's actively suicidal, homicidal, or just in the process of some kind of psychotic or bipolar situation. We will have to call 911 or FIDNY or whatever for them to come and help us evaluate for the person to go to the hospital. We cannot just.
Thank you for that. So the clinic, in essence, is not attached to any health in other healthcare institution, like a Maimonides, a NYU. So that's actually my question.
Okay, not yet, but we will have these agreements that's part of what you do. You have these linkage agreements with the various hospitals. Actually, yesterday somebody came to me from Maimonides. She's working there, and she asked if they could come and see what we have, because we're really closest to Maimonides, or pretty close to Maimonides.
Yeah.
So yes, we are going to have these linkage agreements with the various hospitals, and for that matter, with the different psych units for those people who either are coming from there or we're going to be sending them there. So the answer is
Great. Thank you so much for your response.
okay. Thank you.
Thank you, Samuel. And we move with Joanna and followed by Cynthia.
Hi, thank you so much for your presentation. I actually live about, I want to say like around the block from the clinic. I was really excited. I live on Foot. What's up?
On a job, we're looking for people.
Yeah, so I'm a licensed clinical social worker. So I've already visited your website. I'm actually in my final semester of my DSW, so I'll be a doctor soon. Born and raised in Brooklyn in Sunset Park. I also worked at the outpatient mental health clinic Sunset Terrace, NYU Langone now, whatever it's called. So my question really, I have a lot, but I won't take up too much time, is the so the my what I felt was the hardest about working there was the caseload, right? So like once you start so I wanted to know how many clinicians you have and also like what a typical caseload would be, because I feel like once you have a certain amount of cases, it's not, the therapy is kind of like diminishing, and it's more like, it's more like I just want to get this over with and who's next. So that also I wanted to know if you had like Spanish speaking clinicians. There's a big community, and I think Jeremy had already asked about the health insurances. In your website, it's not listed what insurances you accept. So
okay, let me start with your last question first. We are in the process of updating the website with bios of some of our providers, and that probably will still take another 2 to 3 weeks, but we are doing that. That's to answer the last question first. In terms of the other questions that you asked, I could talk about the different clinics that I've run now, and then this is, like I said, this is my 7th, so we're just starting. We just started 3 weeks ago. The caseload usually runs up to about 30 clients a week, give or take. We pay fee for session, so that it's really a little bit where people are going to do as much as they feel they can do. We are sticklers for notes to be put in, and they should be, as they call it, contemporaneous. We don't want people seeing cases and 2 weeks later filling in notes because you forgot the whole back and forth and so on. But we try, certainly after the session, by the end of the day, and at worst by the next day, so that it's really fresh in their mind. Everybody, for the most part, tells us what they're able to see. Nobody's going to be overloaded, and people are given the types of cases that they're either experienced with or comfortable with or interested in. Some people like to see adults, some children, some seniors, and so on. So it's really to the people's feel. But I'm a big believer that happy clinicians make happy clients. So I do everything under the sun that my clinicians always have. My door is open, and they could always come and talk, and Shoshana's door and Rochelle's door and so on, Karina's door and Daniel's door and all the other people joining us. But we're still putting this together. So right now we're maybe at about 10 clinicians, but I'm ready to hire you. You ready to start tomorrow? Takes about 3-4 days to be onboarded, but I really mean it. I would like to speak with you. Yes, we have Spanish speaking and Chinese speaking and certainly English speaking, but I'm looking for good people, and to add a doctor to the staff would be even better. So but you're what, LCSW now?
yes, I'm an LCSW.
I don't want to steal you from somewhere else.
No, so right now I have a small like a small PLLC, and I'm working for the DOE, so I'm a school social worker right now. So
I'm
my clinical skills are not being very utilized at the schools, I'll say that much.
feel better just talking to you. So you've already done a good job on me. I worked for the DOE for 8 years as school psychologist for the SBSTs. Do they still call it SBSTs? Well, that hasn't changed. And that's really where I started. I worked in East Flatbush, people who came over from the islands, and they were also immigrants, and they couldn't manage the system. And I would go to their houses and I would help them and fill out paperwork and stuff. And I just became part of the community, and I really just care about people. My family came, I don't know, 50 years ago, 70 years ago from Eastern Europe, and somebody gave them a shot. So I want to give people a shot to grow. I would love, again, you want to make up any time, I will meet with you. We'll do a job interview because I want to add people, especially from the community. So just send to Rochelle. She's my executive assistant here, or to Karina. Send them your information and I'll reach out. And you'll come and you'll see something. I think you'll see something different that you're going to like, and then you'll help us grow it because you know the community, and I want to learn this community. Okay.
Thank you, Joanna, and we move to Cynthia.
Well, one of my questions was already answered by Sammy. I had the same questions about the hospital affiliations, and how was that going to work? So I guess you're still working on that. And then my second question, besides these very traditional therapies, do you do anything different like play therapies and any more of the progressive therapies that especially work for children? As an educator myself with over 30 years in the DOE, I think I beat all of you.
Well, you beat me. I only had 8 years, but yes, I really started as a child psychologist. Yes, certainly. I not only have play therapy, I have people who are trained in play therapy. Right now, we have two. We're going to be adding more. In our new center that we're doing, we're building in one-way mirror to help parents and to see how to interact with children. We are doing all types. I don't want to go through the whole list here. I don't think we have to, but certainly parenting is a big piece. And if you come down, you'll see our first area for children, and we're going to grow it from there. But yes, we are looking into different modalities. We do sand tray types of play therapy. Our rooms here are, as I call it, children's therapeutic wonderland. Kids just come and they love it, and they're able to talk and play with old-fashioned puppets and games and toys and technology. And yes, my people two of them are on staff now, and we are going to be adding more. I'm a big believer in working with the children and the parents.
And to Jamie's point, so this is great. You get patients and everything else. But in terms of giving back to the community, will you be offering free workshops, free preventive,
Yes.
informative, things of that nature?
Yes. Let me make it clear. So Daniel is working on some of those things. Karina is working on some of those things. Yes, we are going to be offering, I think psychoeducation is very important. I think health and wellness is important. I think stress management. I could give you the list of some of our groups. Certainly, we're going to wait till the weather clears up a little bit. So we may start it more like in the spring, in 2-3 months from now. Yes, we are going to give back to the community in that way. And it will be, free for people to join. Correct.
And while the Community Board 7 does not do a health fair, there's many other organizations that do health fairs, including Center for Family Life, Brooklyn Sunset Park Lions Club, which I'm the president. We have ours on April 27th. Raising Health, there's many of them that do health fairs and have these things. So I also would say that that could also be another way of giving back to the community, partnering with existing organizations that provide these types of services at large, among other services, to do that as well.
Yes, and that's why we are just rolling out our services, and I'm happy to hear about those possibilities, and we're going to try to join wherever possible.
Thank you, Cynthia. And I will echo the same sentiments as Jamie and Cynthia. We know that you guys opened recently. It's not the problem. It's not about having the service. It's about being accessible to our community members. And I'll take your word on that. I'll definitely will get back to you with any opportunities in the community, including our senior center, which Grisel is representing today. And I'll definitely would like to see more collaboration with the community. We're here to be a partner, but we also want to make sure that the community benefit from these services as well. So definitely echo Cynthia and Jamie on this one. Other than that, if anyone else has any other questions, any other concerns, feel free to ask now, or we will be ending the meeting today.
Would you by chance have any large meeting spaces?
That's what I wanted to answer. I see Samuel asked that question.
Yes.
We are be setting up 120 person. We're going to set up. We have it already, but we're just renovating it. Everything, by the way, was just renovated in the last not renovated, was built in the last 3 or 4 months. So we took that building that's there, must be about 20-year-old building. It's not an old building. And we renovated downstairs, but there is a 120 person conference area that we're going to renovate as well and make it into a brand new place with speaker systems and lighting and so on. So the answer is yes.
Thank you. I only asked that because sometimes we're in need of a space, and it would be great to have one to reach out to.
That yes, I'd like the community to have a place where they might come and if they see it, they'll feel comfortable, you know. But again, I'm happy to show that space, and once I know that there's a need for it, yes, we're gonna fix that. By the way, Sammy, you also invited. Everybody's invited.
Yes, sir. Thank you. I'm gonna take you up on it.
Please take me up on it. I want to show you what we're doing.
All right. Any other questions before we end the session today? On 1, on 2, and 3. All right, so no more questions. Thanks so much, Dr. Slinder, for coming today and presenting and answering the questions from the committee today. We will definitely be in contact with you, and we'll hold you to your words on some of the promises that you made. And we're looking forward to partner with you and to work together to benefit the community.
Stay warm, everybody.
Thank
you. Good night.
Bye.
Thank you.
Bye, everybody. Bye-bye.
Bye, everyone.
Thanks, everyone.